I am Dr. Prasanna Venkatesh. I am a senior consultant pediatric urologist at NU Hospitals, Bangalore. NU Hospitals is the country's leading nephrology and urology hospital, which is having two branches in the city of Bangalore. Both the hospitals are NABH and NABL accredited. What makes NU Hospitals stand apart is that we have all the subspecialties within the broad specialty of nephrology and urology. An important subspecialty is pediatric urology. I am a pediatric urologist both by interest and by training. Pediatric urology encompasses the wide field of genitourinary abnormalities. It takes care of anomalies from the newborn all the way up to adolescence and late adolescence. Pediatric urology encompasses problems with both boys and girls. Most of these problems are congenital, but a few of them can also be acquired as the child grows up. In close conjunction with the pediatric urologists, we require pediatric nephrologists who take care of the medical problems of the kidneys, and those unfortunate children who have chronic kidney disease are jointly managed by the pediatric nephrologists and pediatric urologists. The variety of treatment for these children with chronic kidney disease would include certain preventive measures, certain measures to prolong the existing function of the kidneys. Few of these children would require peritoneal dialysis, hemodialysis, and some of them would also require renal transplant. Coming to the specialty of pediatric urology cannot be practiced only by urologists. It requires a team to deliver on the services. The team would include pediatric nephrologists, pediatric anesthetists, pediatric nurses, pediatric intensive care, dietary services, and pediatric incontinence specialist nurses. We are also proud to have the country's first dedicated pediatric urology and pediatric nephrology ward that was started at our Rajajinagar facility at NU Hospitals in Bangalore. Pediatric urology covers multiple problems, the most commonest being undescended testis, hypospadias, problems with the prepuce, posterior urethral valve, PUJ obstruction, vesicoureteric reflux, bowel bladder dysfunction, neurogenic bladder, and pediatric urological tumors which include Wilms tumor and neuroblastoma. By the sheer complexity of these problems, it definitely requires a multivariate, multi-specialist team to handle this. Most urological problems having associated neurological issues which may arise from the spine or the central nervous system also require pediatric urodynamics for evaluation. Pediatric urodynamics itself is a specialized field where the child undergoes pseudoanalgesia for the procedure, and then the neurodynamics of the bladder are actually pictured, and this helps us to a great extent to decide on the next course of treatment for these children. Today, when widespread junk food is available and when children's activities are far lesser, there is a new problem which is developing amongst the children, which is called as bowel bladder dysfunction. This results in urinary tract infection in children. Please remember that no child should have a urinary tract infection. If a child has a urinary tract infection, then usually there is a cause. The cause needs to be identified after treating the acute symptoms of the urinary tract infection. And one surprising result which we find amongst all these children is that a lot of them have bowel bladder dysfunction, where these children postpone the act of passing urine. They are so busy doing whatever it is that they are doing, watching television, on the gadgets, or playing with the phones, or even playing in the field, that they simply forget to actually get up and go and pass urine. The fact that they hold urine for a long time results in urine infection. The fact that their dietary practices have changed, where the overall fiber content in the diet is much less, has resulted in constipation, and constipation is one of the most important causes of urinary tract infection. So when evaluating a child with urinary tract infection, it becomes important to identify the cause, treat the symptoms, rule out any other congenital abnormality like pelviureteric junction obstruction, vesicoureteric reflux, any bladder outlet obstruction, primary obstructive megaureter, etc., etc. Once you have done that, keep a very high index of suspicion of bowel bladder dysfunction in mind. Get the parents and the child to do a bladder diary, take the stool history of the child, and then start the treatment. Another wide array in which pediatric urologists can definitely help is in nocturnal enuresis. We are aware that most children should stop bedwetting up till the age of 5. After 5, if they continue to bedwet, this is a condition that can easily be diagnosed, and today there are excellent treatments available. We no longer need to refer them to a psychiatrist or put them on imipramine. Again, a lot of these children would require urotherapy with alarm treatment, and at the most a few of them may require desmopressin melt. Urological tumors in the pediatric age group are luckily not very common, but when they do happen, if they have been detected early, for example, Wilms tumor, neuroblastoma, rhabdomyosarcoma, these are tumors that can be treated well, and most of them have very good 5-year survival rates. To put it in a nutshell, pediatric urology and pediatric nephrology is an upcoming specialty within the broad array of urology and nephrology. It can definitely not be a one-man show. It requires an entire department with a lot of supportive help in order to provide these children the best of care. I would like to inform you that I would share my experience, thoughts, anecdotal cases that are important amongst the doctors with the White Coats digital platform.